St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. You are big that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards of this. And we wish that you would find us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Health Talk Show with me, Maureen Kimani, a program brought to you by Capuchin TV in partnership with St. Mary's Mission Hospital in Langata. Well, the reason why we bring you this conversation is to help you to understand more on health matters as a person, as an individual, and as a group, your family, your relatives, just to make sure you are very fit and you can continue with the daily activities being healthy. Well, today our conversation is about benign prostatic hyperplasia. Well, maybe you have ever heard of this name, that is BPH. And just to give you a few details on the statistics, that is as many as 40 million men in the United States of America have symptoms of BPH, and approximately that is 30 million men in globally have these symptoms of BPH. Well, what kind of symptoms are we talking about here? Well, joining me in the studio, we have a guest from St. Mary's Mission Hospital who will be introducing herself and telling us about this conversation of BPH, benign prostatic hyperplasia. Welcome. Hi, good morning.
Good morning too, Maureen.
How are you doing?
Fine, thank you.
Good to have you here. Thank you for coming and for making time for this conversation.
Oh, pleasure too.
Yeah, because it's the first time you're here, you can introduce yourself to our viewer, tell them what's your name and what you do in St. Mary's Mission Hospital.
Okay, good morning, family. My name is Naomi Ayecha from St. Mary's Mission Hospital. I'm a nurse there. Yes.
Thank you so much. Well, we're talking about a BPH, that is benign prostatic hyperplasia. What is it all about?
Okay, benign prostate hyperplasia. It's all about prostate. It's when the prostate enlarges. What brings to this enlargement of the prostate? It's when the smooth muscles of the prostate become enlarged because of the changes of the hormones. Which hormones are we talking about in this case? It's about the androgens and the testosterone hormones. Okay, when the androgens, they are converted to DHT, dihydrotestosterone hormone, and then they make the smooth muscles. The cells in the smooth muscles, they keep on multiplying. When they keep on multiplying, when you get the prostate being enlarged. So in short, is the enlargement of the prostate. Yes. Okay. Wow. In short, the prostate gland. It's good to know where it's located. It is seated deep down in the pelvis. Okay, we have the bladder, we have the urethra, we have the rectum at the side, and then below is the pelvis. So the prostate is the part of the urinary system. As I've said, it's below the bladder, and in within there's a urethra, and besides it, it's a prostate gland. Yes.
Well, today the conversation is all about the men.
Yeah.
Well, what is a prostate gland?
Okay, a prostate gland, it helps, a prostate gland is part of the urinary system. It helps in regulation of ejaculation or regulation of the urination. Yes.
And you just talked about where it's located and what's the importance of this prostate gland in men's body. Well, and to you, our viewer, just in case you have joined us right now, we're talking about benign prostatic hyperplasia, that is BPH, and in short, it's just the enlargement of a prostate gland, right?
Yes.
Yeah, because right. the name itself, it's very ambiguous.
Yeah.
Just to break it down, it's the enlargement of a prostate gland. Well, let's continue with this conversation. What are the problems related to this prostate gland?
Okay, we can say there are risk factors. Yeah. The risk factors of the prostate gland, they are non-modifiable risk factors. You can't modify them. Okay, it's the example of the non-modifiable risk factors is like age. We come with the race and the family history. Yeah, like when the family history, you can say when your brother or the father had the benign prostate hyperplasia, there's high percentage of you getting it. And then when we talk about the age, as you age, the percentage increases. As you age, you will get this benign prostate hyperplasia. So when you reach at 40, there is a systematic reviews of studies. They have come up to show that above 40, maybe we start from 30 to 40 years, it's about 8%. It's a lower percentage. But when you go to 40 to 50%, the percentage increases. It's around 50%. But now when you go to 80, at 80 years, also the percentage increases. It goes up to 80%. Yeah. Yeah. So far we have the non-modifiable risk factors.
Okay. As we continue, before we just expound on the risk factors, we understand that we have 3 problems that is related to these prostate. We have the prostate cancer, we have the inflammation, and we have these BPH that we're talking about.
Yes.
Maybe we can just expound more on these 3 prostate problems.
Okay, the 3 prostate problems, like the prostatitis, is the inflammation of the prostate. It's affected the middle-aged men. Then we have the prostate cancer. It's found among the old age, like as we start from 65 or 55. The studies are not showing clearly the ages. And then we have the 3rd one is the PPH. It's the most common occurring. Yeah, as you had said that the worldwide we have 30 million men that are showing up these symptoms. And again in USA you had said that it is 14 million men that are showing these symptoms. When you some of the systematic studies reveals show that 20 to 62% men aged 50 years and above, they are also showing up these symptoms. So BPH is the most common occurring, followed by the prostatic, and then the prostate cancer. Yeah.
So BPH is the most common prostate problem that is related to men, you can say?
Yeah.
Oh, okay. So what does it mean, as you have said in the first introduction, that is 30 million globally men have these symptoms? What kind of symptoms are we talking about here?
Okay, when you maybe those who come to the facility, they come presenting with maybe they come as they come, we have to check history, a detailed history. If this is where the family history comes, when you ask this client, is there anyone in your home who has ever had this benign prostate cancer, I mean hyperplasia? Yeah, you can find maybe a father or a brother had it. Again, when you talk about
it's the symptoms we have.
Okay, the symptoms now we have here. The first one, we can say it's nocturia. Nocturia is when you keep on peeing at night. You keep on visiting the washrooms. This is because when this muscle, this prostatic muscle, they grow, they keep compressing the urethra. When they keep on compressing the urethra, you can visit the washroom, you go void, then there are some amount that remains in the bladder. So you go, you pee, you come back, and then there's an urgency. Then you go back. There's urgency and there's frequency. Frequency, you keep on going, and urgency. When you have just voided, there's an urge that comes that I need to go to the washroom. So far we have said 3
We have the nocturia.
The nocturia, we have the urgency, we have the frequency, and there is complete obstruction. When this prostate gland enlarges, they compress the urethra. It comes at a time when the urethra is being compressed completely, causing the blood obstruction. When there's a blood obstruction, urine can't, this client can't pass urine. So they come with abdominal pain, abdominal distension. When you palpate together, there's not abdominal, bladder distension. Yeah. And there's also dribbling.
Okay.
Yeah. When you go pee, there's some amount that remains in the bladder, and there's when the urethra is being compressed with the prostate gland, the urine is not released fully, so it comes dribbling. Yeah.
It's talking about a nocturia part. How many times is a man, because our conversation is men, are they supposed to pee at night?
Yeah, they are supposed to pee at night, but there's that
how many times?
You can wake up to 6 times. Yeah.
Okay.
Yes.
And let me take you back on the risk factors. You talked about the age, we have the family history, and what about a lifestyle that is on diabetes patients?
Okay, lifestyle on diabetic patient, we always recommend that you eat a healthy diet, because BPH, it doesn't have the main, what causes BPH. So we had talked it's about hormone, but when coming to diabetic, we insist on healthy lifestyle. Like you can't consume meals with high potassiums, because with the BPH, when you consume food with high potassium or high sodium, because when there is obstruction of this urethra, there's going to be accumulation of urine in the blood. So when it accumulates, it is going to retain the electrolytes, and when it's going to retain these electrolytes, when you go do the lab works, you can get high levels of these electrolytes, like the potassiums, like the sodiums, and this now it's an emergency, because when you have hyperkalemia, it can lead to heart conditions. Yeah.
Okay, and what about the erectile dysfunction, that is ED?
Okay, erectile dysfunction, I can say it can affect, because when the prostate gland is affected, we can see that some of the nerves that innervates the penis, it sends blood to the penis for erectile functions. I can say that it can affect this function, because it helps in innervating the penis. It sends some blood to the penis. Yeah.
So are these symptoms are painless or they're painful?
Okay, it depends with the client. Yeah, it can be painful or painless. Yeah.
And how long does it take for them to worsen?
Okay.
That is, if you don't go for the checkup, once you have these symptoms and signs, you're feeling uncomfortable, you have these nocturia that we have just talked about, how long do they take to worsen? Okay,
it depends with the symptom. Like when one comes with blood obstruction, comes when the urethra is compressed by the prostate gland. Okay, when one comes with these blood obstructions, this person is going to complain more pain. It worsens when the blood is full. When this client takes a lot of water, a lot of fluid, it's going to form and it accumulates in the blood. The more it accumulates, the more painful it is. Yeah, and when we come to that's one of the symptoms. When it comes to the dribbling, it may last. Yeah, maybe it starts, maybe a client comes, says that these symptoms have been there for the last 1 month. Without getting this, if he can't come for management, it can last, and it will continue worsening, because the urethra is being compressed now and then, so it can worsen slowly, but we recommend that this client comes to the hospital for checkups so that they may not worsen up. Yeah.
Okay, as a nurse in St. Mary's Mission Hospital, I'm sure you have interacted with these patients that have these benign prostatic hyperplasia. Tell us your experience, and what did you notice on these signs and symptoms when a patient came to you?
Okay, when a patient came to me with these signs and symptoms, they come with severe abdominal pains. They complain hematuria. Hematuria here means that there's urine in blood. There's blood in urine. Sorry for that. My experience is that when they come with a lot of pain. They come with a lot high blood pressures. They come with the inability to void. So in my experience, you can get in 10 men, there are 4 having PPH. Now it's common. It is 4 out of 10 is a good quite number. So in my experience, we take a detailed history, we take a physical examination, we recommend for lab works like the urinalysis, we recommend for a PSA, prostate specific antigen, which will detect someone has a physical examination. We do a DRA, a digital rectal examination. After doing this, we diagnose this. If it happens, the patient is being diagnosed with BPH. We do management of this patient. I understand that PPH is treatable. Yeah.
That is, it's treatable as a patient volunteers himself before the symptoms worsen.
Okay.
Is that what you mean?
It is treatable even if he comes with the symptom, because through this physical examination, through this lab work findings, it depends if the obstruction is incomplete. We treat with a first line management. We give medication. We give medication that is going to relax these smooth muscles. It is going to dilate. We call it a vasodilation, because when vasodilation comes and the relaxation of the smooth muscles, it is going to release this urethra. And then there's improvement of urine flow through the urethra. Yeah.
Okay, and before we just take a quick break, tell us what's the treatment of this BPH?
Okay, the treatment of this BPH, we start with the giving medication. We give a medication which is alpha adrenergic receptors. The example of this medication is tamoxifene or prazosin. It helps in vasodilation of the arterioles. It helps in smooth muscle relaxation around the urethra, or it vasodilates the arterioles in the prostate gland, or it relaxes the smooth muscles. When all this happens, it is going to release the urethra. Through giving the medication again, if these symptoms persist, it's when we recommend for surgery. Yeah.
And before you tell us on of the blood test, we have the digital rectal exam, right?
Yes.
Okay, and to you, in case you have a question for this conversation that is a benign prostatic hyperplasia, you can send the text on 0717-424-86, or you can use the SMS number that is 21760. We'll be back after a short break. Stay tuned.
Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage
Asia, and in the studio we have a guest from St. Mary's Mission Hospital, that is Naoma Ayecha, who is a nurse. And as we continue to engage ourselves in this conversation that involves the men in the society, we're talking about a benign prostatic hyperplasia, and just for the details, in case you're joining us right now that you missed, it's 30 million men globally have these signs of and symptoms related to BPH, and we've been talking about that about these symptoms. That is the age, we have the family history, we have the lifestyle, and many more. And as we continue to talk about this conversation, we're going to continue with the surgery part from where we left, right? Welcome back, surgery part from where we left, right? Welcome back, Naum. And tell us, when does the doctor recommend this surgery to a patient with BPH?
Okay, thank you again. Okay, the doctor recommends this surgery. It is called TURP, transurethral resection of the prostate. It comes when we have treated this patient, we have given the medication, and the symptoms are not going. Okay, and at the same time, when this patient has a bladder stone. So when you are given, you have exhausted the first line treatment, you have given the medication, the symptoms are persisting, we recommend for this surgery. TURP means it's a tiny electronic camera that is being passed through the penis all the way to the urethra, and the resection is done. Resection means it's when this device takes part of the prostate gland, it cuts to relieve the urethra. Yes. And the cystoscopy is when you visualize the bladder, you see the problems affecting the bladder, and if need be, we take a biopsy for further investigation. Yes. And
who can go for this surgery? Because we have these patients that have the diabetes and many other diseases. Are there some of the criteria that you use for a patient to undergo the surgery?
Okay, based on the TURP, we are focusing on the urinary system. Okay, this patient comes with the problems with the dribbling, it's persistent, comes with the urinary blood obstruction, comes with urgency, comes with frequency. As I had said earlier, when we had treated these symptoms and they are not good, they have no improvement, yeah, it's when the surgeon recommends for a TURP. Okay, the diabetes patient, we can say it's also another factor that can lead to this problem. It's all about their lifestyle. But when this diabetic patient represents with these symptoms, and again we have treated him and they are not improving, we recommend for this surgery.
You said that it can be cured. You just mentioned that in the first part. And once this surgery is performed, can this BPH reoccur again?
Okay, I can say it can reoccur depending also when the hormones, when this hormone change again. Yeah, if, for example, a patient comes, we have recommended for this surgery. He has gone and TURP is done. He goes back home with no more voiding, no symptoms again. But I can say it is treatable, but at the same time it can reoccur because of the changes of the hormones. Remember, a DHT hormone, it can cause this symptom to occur. Yeah, BPH can reoccur again. Yes.
Okay, and you just talked about the medication that is referred for this treatment of BPH. What are some of the side effects that a patient can, have?
Okay, side effects of the medication that the patient can have. I can say that when giving maybe a drug called prazoline or tamoxifene, its main mechanism is just the vasodilation. vasodilation and relaxation of the smooth muscles. The main side effect here, I can say it's hypotension, because the flow of blood will reduce. So we became, when we are giving this medication, because it causes orthostatic hypotension, we begin on this patient of change of position, because when change position occurs quickly, this patient may fall down, and it brings another injuries to the patient. Again, another side effect, I can say it's dehydration, because we are trying, we give medication to help this patient avoid dehydration. You can experience dry mouth, and then during this dehydration, again, we are losing a lot of fluid. We can dehydration causes hyperkalemia, electrolyte imbalances. Again, I can say another side effect. We have said it brings low blood pressure. It brings about
dehydration. What about constipation?
Yeah, it brings constipation. Again, it brings about dizziness, and it brings again headaches, because you are losing a lot of fluid. Yeah.
And how is a UTI connected with this BPH?
Okay, UTI is connected with the BPH because when you retain, you retain. It's a waste product. Urine is a waste product. Yeah, it remains in the bladder. Through that accumulation, being a waste product, it is going to bring about the UTIs. Yeah.
And what are the do's and the don'ts for BPH patients?
Okay, for BPH patients, I can say that the do's. We have said that the cause of the BPH, we have non-modifiable factors. Yeah, we can't modify it. You can't modify age. If you are 21 today, you can't go back to 20.
True.
You keep on going 21, 22, and it's
getting older.
And it is a family history. It's about ethnicity. It's about the race. Yeah. So when we talk about the dose, I can say we anticipate for healthy lifestyle. We recommend them to do exercises. We recommend them to practice healthy diet.
And when you talk about the healthy diet, maybe you can just mention which healthy foods are we talking about here?
Okay, healthy food here. I can advise these patients or the clients or the men outside there that it's good you avoid consumption of alcohol. That's practicing good diet. Avoid consumption of alcohol. Avoid smoking. Avoid getting too much saturated fats. I don't know if in the future we'll be using tobacco.
God forbid it won't happen.
It won't happen.
Yes.
Yeah, I've said that again, exercises. Do a lot of exercises to make your body to be strong, active. Yeah. And they don't see the vice versa. Yeah.
Okay.
Yeah.
And because you just mentioned on the age preferences, that is from the age between 30, we have the 50 and 80s, that is for the older men. What are some of the ways that can be done to prevent this BPH for the young men? That's what you're talking about in future, when they are in their 80s and they are in their 50s, they may not have this BPH. Are there some of the ways?
Okay, some of the ways that I can advise this young man not to have BPH in future is all about healthy diet. It's all about the exercise, and also when we had said earlier that BPH comes around age 40, age 50. When you reach 40s, it's when this problem comes. I would wish to advise these young men when they reach age 40, they come for screening. Even the systematic research studies are showing even at early 30s, 8% of early 30s they present with BPH. So it's good you visit the health facility, you be screened. We do a simple screening. Mostly when you present with these symptoms, we do a DRE, a digital rectal examination, before we proceed to other diagnostic tests.
So men can come for this BPH screening, is that what you mean?
When they reach 40s.
Okay.
Yeah. Yeah.
All right. And just to take you back on these prostate problems, I mean related prostate problems, we have the inflammation, we have the prostate cancer, and we have the BPH that we're just discussing about. Does this BPH cause prostate cancer?
Okay, research is showing that it does not cause cancer, but debate is going on. Because even cancer, the risk factors are the age, risk factor is the family history, and the race or the ethnicity. But research is ongoing, whether, because the same thing that is causing, the risk factors that is causing the BPH are the same risk factor that's causing the prostate cancer. But research is ongoing. Yes.
And in case a man just have these symptoms, how long should they observe themselves as before they volunteer to a health center, of which we have the St. Mary's Mission Hospital?
Okay, I can say the earlier you come, the better. Don't wait for them to worsen. You may experience dribbling, you may experience frequency. It's you to wake up and visit the facility, because the more you stay back at home, the more they worsen. Yes, it's better they visit the health facility for further management. Yes. Okay. They can worsen. You may start today having obstruction. You know, obstruction is not a good thing. It's a bladder being distended. As it distends, there's more pain, there's severe abdominal pains, and it can cause even hematuria. So when maybe one experiences blood obstruction, it's better to come to the hospital for further management. Yeah, because this obstruction again can raise high blood pressures. It can bring more problems to the body. Yeah.
Okay, and are there any myths related to this BPH?
Okay, so far I've not had any myths, but others can say maybe it is maybe I can say maybe it is a taboo, but I think there is no relationship. We had said maybe it's because hormonal changes. Yeah, for so far in my experience, I've not had anyone complaining because there's a myth, no. Yes.
Okay, and just taking you back on the global statistics, we talked about the 30 million men have these symptoms related to BPH. How should they worry about this BPH when it comes to the men?
They should be worried because 30 million worldwide is a bigger number.
Yeah, sure.
Yeah, we recommend them that they may be curious. When they experience these symptoms, they have to come to the hospital. Now, in short, we say that BPH is the first or is the leading problem with the prostate.
Yeah, sure.
Yeah. Yeah. When you say it's 14 million in the USA, only USA has 14 million. We should be curious about the BPH. Yeah.
And there is no statistics that you can give here in Kenya?
Okay, in Kenya I can say as you age, the percentage keeps on increasing from maybe 20 to 62%. It's okay in men having 50 years and above. They present with the BPH. Yes.
And once this BPH is diagnosed, how long does it take to cure?
Okay, it depends with the medication that you are receiving. Like when you give this medication, like the tamoxifene I had said earlier, it can take up to 6 months. And then you start getting the relievement. It can take up to 6 months, and then these symptoms start going away. Yes.
And in general, is there anything that you want to talk about the benign prostatic hyperplasia that concerns the men's case?
Okay, I can say that benign prostate hyperplasia, it's real. It's real. In our facility back in St. Mary's, you can get 4 out of 10 for having BPH. You can see it's a good number. 4 over 10 is a good number. So my big shortage is, I can say that benign prostate hyperplasia, it's real. When you receive these symptoms, you just visit the health facility for further management. In St. Mary's, we have a quite number of facilities. Yeah, you can visit us. You can visit us so that you may get treatment. Yes.
And when does one visit the clinic in St. Mary's Mission Hospital just to have the services of BPH?
Okay, one can visit any time of the week. You can visit a general consultant, but the specific clinic days are on Fridays. Yes.
Okay. And so your parting shot on this BPH, that is benign prostatic hyperplasia, is that men should take care of themselves when it comes to lifestyle. You have just mentioned about the taking of alcohol, we can just say the drug. The drugger. And we have doing a lot of exercises and making sure that in case you have these signs and symptoms, you can volunteer yourself to IH for making time to come to our health talk show with me, Maureen Kimani, and on behalf of Capuchin TV, we are very grateful for sharing such kind of a topic to our viewers and to help these men to take care of themselves. Thank you so much, and may God bless you. That is Naomi Ayechia, who is a nurse at St. Mary's Mission Hospital. We've been having her here. It was a pleasure. We've been talking about the benign prostatic hyperplasia, sorry for that. And may God bless you. Thank you so much for staying tuned to this health talk show. Stay tuned and keep it health. Goodbye.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Jumatatu hii
tunaweza kujivunia ya kwamba sisi ni watu wazima kwa kiimani.
Ndugu zangu na dada zangu, tukiongea juu ya kanisa ni wewe na mimi.